The stages of grief for chronic illness and chronic pain. Let's get into it. You might be familiar with the Kubler-Ross 5 stages of grief that seem to be very popular when it comes to conceptualizing grief. But they don't fully encapsulate the experience of grieving chronic illness, chronic pain. And so I came across this article years ago by Jennifer Martin, who's a psychologist, and she kind of reimagined the stages of grief, adding a couple extra stages specifically for chronic pain and illness. And I really like this. I feel like it does a better job. And so I'm going to go over those 7 stages with you today. The first stage is denial, of course, and she kind of goes on to say that this is more like shock and disbelief. So in this stage, we often will ask ourselves, like, how is my life going to change with this new diagnosis, and how am I going to deal with these changes? It's important to know that in this stage that it really does kind of help us initially cope with and survive this new big change that we have going on in our lives. So denial is absolutely a necessary stage. We just don't want to linger in it for too long. The next stage she calls pleading, bargaining, and desperation. And I remember really identifying with this at the time, and this was before I even had a diagnosis. But essentially in this stage, we have a lot of resistance to the change. We do anything we can desperately to try and keep things the way they are in our lives, to try and prevent ourselves from having to change. I mean, I think we all go through this at a certain point. We try to barter and, if I just work out a little bit more, maybe this will go away. If I just eat better, maybe this will change things and I won't have this big, long, life-changing illness. We also might have a lot of thoughts of like, did I do this to myself? Could I have prevented this? Is it because I did too much of this or not enough of this? And as we kind of round out this stage, we really start questioning our identity. If I do have to change, what is that going to look like? Who am I going to be? And then, of course, once we realize that no amount of pleading and bargaining and doing yoga and changing our diet is going to change things, then we move on to the anger stage, where we just get angry about everything. We get angry that we have an illness. We get angry that we have to make life changes. We might get angry at whatever the treatment options are or lack of treatment options. We get angry at the limitations that it is imposing on our lives. This is a normal and appropriate stage. It's important to express this and allow ourselves to feel this because, it's self-protective, and we definitely need to process these feelings before we are able to move on. Sometimes we stay in the stage for a long time too, and that's okay. Then comes the stage that she puts together anxiety and depression. And she talks about how this is a normal adaptive response to going through loss or a life-altering situation. And she says, that it can feel like it lasts forever. One of the things I usually say is that I feel like anxiety and depression with chronic illness, while both of those can be symptoms of a chronic illness themselves and manifestations of the illness itself, that I find that these get worse with the ebb and flow of flares and symptoms as they worsen. But she also talks about how there's a lot of anxiety and depression around depression, like grieving the past, but anxiety around like, what's my future going to look like now that I'm realizing that all these things I've tried are not necessarily going to change anything. The next stage she calls loss of self and confusion. And this is where that identity crisis really peaks, right? We're questioning, what's my life going to be like now? Who am I without being able to do these things or without being able to be the same person that I was? We're realizing that we can't be the same people we were and be managing this illness and attending to it the way that we need to. And so we might be, as she says, questioning our purpose in life, that this comes with a lot of anxiety and depression. So these can all be coming together. But she also talks about how this stage is completely necessary and normal, and that we kind of have to process through this just like all the other ones. The next stage is the reevaluation of life roles and goals. And this one is where, after we've been kind of questioning where we fit in, we're now reevaluating. We're essentially trying to rewrite our life and who we are. We're recreating our identity. We are finding ways to maybe incorporate some of those old parts of ourselves or things we used to do in a new way that fits our chronic illness and our needs now. And we're starting to adapt and evolve with chronic illness in mind and figure out what our new normal is, which is a term that a lot of us are familiar with. And so we're exploring that. We may not have settled in it, but we're exploring it, and we're trying to really focus attention on what that might look like, and we're starting to open up to that. The last stage she calls acceptance still. I like to call this stage integration, because acceptance, I think, if you think of acceptance as being like, I can sit with the fact that I have a chronic illness, I think a lot of times, and a lot of my clients have shared this as well, like we have no choice but to sit in acceptance to a certain degree. We might have resignation about it, but like we have to accept the fact that we have a chronic illness in order to be treating it. And a lot of times we don't have any choice. We have to get there really quickly, right? But we might not have integrated it into our lives in a way that's healthy and adaptive, and we're thriving, right? So she describes this stage as that, like having fully integrated our illness into our lives, and that we have learn to come to the realization that while it's going to be a normal part of life for us, and we may not necessarily have asked for it or have wanted it, that we are starting to learn that we can do things with the illness, and it may be in a different way, and we may not be okay with being sick, which is part of the reason I don't necessarily care for the word acceptance. But I like to call it integration because it's more active oriented, right? Like we've found ways to integrate the illness into our lives. We've found ways to give it a part that it needs, but not make it our whole story, so to speak. And that we also are taking an active role in managing our illness and doing self-care and setting boundaries that we need to set for ourselves. So they don't always come in this order. We can go back and forth. We can be in denial and still be in shock and disbelief while also be exploring new roles and life goals for ourselves. I mean, this is not linear. It often looks like this, as I tell people, and that's okay, and that's totally normal. But I wanted to kind of just expose you to a different idea of what the stages of grief might look like with chronic pain and illness. So if any of these really hit home for you, let me know in the comments.